So, good afternoon. This is Joe Tittle from Eastside Family Care Center. About a week ago today, I sat down with Mark Duchesne at Elevate Fitness because he had questions about the coronavirus and he wanted to know my advice regarding coronavirus. It's been a week, and I've noticed almost on a daily basis, as soon as a press conference is over from the White House or a local press conference, within 30 minutes, it seems, everything's new and everything's changed. So I just thought I would sit down and kind of go over the questions him and I discussed and take about 10 minutes and just update that. Let's start with statistics. Right now, here in the United States, we have about 115,000, almost 116,000 cases. Again, that may have already changed since I checked the website. As of 4 p.m. yesterday, we had 1,668 people pass away. Just to put that in perspective, New York City has 450 deaths a day, approximately one person every 17 minutes dying from coronavirus. But on a normal day, without coronavirus present, New York City has 419 deaths per day, one about every 9 minutes. So coronavirus is not quite as deadly as we think, I believe. Let's talk a little bit about this 15-day waiting period, staying at home. I think the president did this because this is a virus. It's something new to our body, can be dangerous, especially to our elderly and weak, and we'll talk more about that later. But more importantly, so it wouldn't completely overwhelm the medical system, the hospital system, with a large number of sick people coming in. For the most part, your body will take care of the virus on its own. And so, we're in about the middle of that. Maybe in a week or two, we can start talking about where we can come out. There seems to be pockets of places around the United States where it's not as severe. Like, for instance, in the state of Florida, Miami-Dade County has a large number of people who have coronavirus and a large number of hospitalizations and people who are ill. But there are 20 other counties in Florida that have not even one case, and some have one case or less than 5 cases. So Florida's been able to shut down Miami-Dade County, keep their state running, and keep everything focused on Miami-Dade County, and that's where all their health care is going. So Mark asked a question about staying healthy during this time. What are some things that we can do? I would not change anything I told him on that day. Wash your hands frequently, 2-3 times a day. They say every 20 minutes. I think that's probably a little bit excessive unless you do what I do and you're seeing people who may be sick all the time. But wash your hands with soap and water. Remember, the more foamy the soap is a phosphate, and it breaks down phospholipids, which makes up the cell wall of the virus. So it actually kills it, but it also actually attaches to it and pulls it away from your skin. What can you do at home to make your immune system stronger? The 2 best things you can do is, you're off work right now, rest. Get plenty of rest and sleep. Shoot for those 8 hours a night. Get out in the sun during the day. Spend some time in the sun. It's good for your mind. It's good for your immune system. When you feel better, your immune system works better. Plain and simple. What can you take? I wouldn't change that from just your normal daily vitamins and things like that to keep your immune system healthy, to keep you healthy. Let's talk a little bit more about the coronavirus. We know it is a new virus, right? It's a cold virus. We have 4 other ones. This one happens to be new to us. It seems to be a little bit vicious and cause problems. But again, where it's causing problems is in the most vulnerable people. Way back at the beginning, we heard President Trump talk about how we believe 80 to 85% of people don't have symptoms or asymptomatic, and they just recover on their own. This is not just a number pulled out of the sky arbitrarily. If you remember the Diamond Princess, the ship that pulled into the harbor in Los Angeles, they tested everybody on that ship To say you've recovered or been cured from the coronavirus, you need 2 negative tests. So what they did was they tested everybody on that ship because they had a lot of people who had it. And what they found was 80 to 85% of people didn't have symptoms, but they were positive for it and never developed symptoms, or they were so mild they didn't really seek attention. They also found out that these numbers about the death rate and the ones who get seriously ill from this one small area, they also found that in that same area, the same mean age group, age 60 and above, get the most sick. Age 80 and above are the ones most likely to die. That's the mean age. So this is where a lot of this information comes from, and so far we're bearing it out. We're at right now 115,000 deaths, with around 1,600, maybe 1,700 deaths. 115,000 treated, with around 1,600 deaths. We're in that 1.27, 1.3% range. We're doing really good there. Testing hasn't changed much. We still don't have a lot of tests. This is the reason why we're still all supposed to be quarantining at home, staying in place. We can't just test everybody who wants to be tested because they might have a little symptom, maybe a mild cough, maybe a real low-grade fever. The standard remains the same. 100.4 degree temperature with body aches, along with a severe cough and shortness of breath with the cough, we will test you. If you're vulnerable, if you're particularly vulnerable, someone over the age of 60, if you have had a reason to be immunocompromised, like cancer, maybe people with HIV or AIDS, the elderly whose immune system just doesn't work as well, we will not test you necessarily in our office, but we have about a 2-page screening we need to do on you. Then we can call the epidemiologist at the county. We have implemented drive-through testing in El Paso, but once we collect that information on you, we have to call that information, report it to the hospital or to the epidemiologist, and at that point, he will make a decision, and he'll give us control numbers, and he will also give us the location where you can go and be tested. And if you don't have all of that, at this point, we still will not test you. Again, we're trying not to overwhelm the system. Hopefully, soon we're going to have a test that can be done in the office, just like the flu test or the strep test. And we'll have the answer in about 10 to 15 minutes. Right now, Apple has developed an app that you can get on your cell phone, maybe your iPad, and you can just follow it, and it will tell you, it'll give you advice for what you need to do based on your symptoms. It will not tell you to go get tested somewhere. It might tell you to come to your doctor's office and get checked. But again, we have about a 2-page screening we need to do on you. And if you think you've been exposed, we need to know the name of that person you got exposed from so we can contact the health department. Needs to know all of that information. So the testing is not a whole lot easier to get to, but it is a little bit easier and it is more widely available. This is why our numbers are going up so quickly in the United States. We have our tests, we develop them faster, and we are testing at a much higher rate. But out of that 115,000 that they reported at 4 p.m. yesterday, they tested 432,000 to get that 115,000 positive. So stay positive, get lots of rest. Hopefully we'll be out of this quarantine soon, and we can start moving around like Americans should. If you have any questions, feel free to call our office. Talk to us on the website, on our Facebook page. We answer as quickly as we can. We're still seeing patients in the office, and if you're symptomatic, we are going to try to keep you away and screen you in the back parking lot or something like that, and send you away from there if we need to. Take care of yourself. Stay safe. Wash your hands a lot. Have a good day.